Medicare doesn't make sense. So here at Healthcare Solutions Direct, our goal is always to keep this simple as 1, 2, 3. For a lot of individuals that are having some problems with their prescription drugs as far as high cost goes, there are some things that can be done. We'd like for you to give us a call here at Healthcare Solutions Direct so that we can make sure that we can kind of go over these with you over the phone. But let's talk about some of these things. There are some formulary exceptions and step therapy that can be done to lower the cost. So the individual can ask the Part D drug plan, which is for what is called a formulary exception. So a formulary exception is where the individual is asking for a non-preferred drug at a better cost, to have the drug covered on their formulary list and not require them to complete what's called a step therapy program. This request is not an easy process for a drug plan to agree to do that for the individual, but it is possible to get a formulary exception. Step therapy is where the plan is going to require an individual to try a less expensive drug before covering the more expensive medication at a lower cost. So the individual would need to consult with their doctor to find out what's the best course of action for their high cost medication if they feel that the less expensive medication is not appropriate for their particular condition. There are also a lot of pharmaceutical assistance programs that might be available to an individual that will help pay for some of these high-cost medications and provide some financial assistance. So there are pharmaceutical programs that can be found on Medicare's website, or an individual can call the drug manufacturer directly and see if there are any programs that are available to them through that actual drug manufacturer. There's also some states that offer pharmaceutical programs through the state that can help the individual get assistance for some of these high-cost medications. Not all states offer this, but the ones that do will be listed on Medicare's website. You can always give us a call here so that we can look at your state and see what's available to you. The other big thing that most people don't look into, which might be available, is extra help. So this is a program that many individuals could qualify for, but either don't know about it or they're taking generic medications already that are relatively inexpensive, so they don't think that it applies to them. Extra Help Part D is offered through Medicare and Social Security as a benefit to help an individual with limited income or resources and who might not qualify, for Medicaid. So if you didn't qualify for Medicaid, there might be some options to be able to get some extra help for your Part D though anyway. So if the individual qualifies for Extra Help Part D, they will pay no more than $3.70 for generics and no more than $9.20 for brand name medications set forth in 2021. The individual could also get their Part D premium covered and any deductibles waived under that plan. So here are some of the qualifications for Extra Help Part D. So the annual income must be below $19,140. The annual income right now has to be below $19,140 or $25,860 for a married couple, and the financial assets are below $14,610 or $29,160 for a married couple. So if the annual income is below those thresholds and the financial assets are below those thresholds, you may qualify for extra help. So if that's something that you think might be applicable to you, please give us a call here at Healthcare Solutions Direct so we can look at this for you and help you with that application process for the extra help. So financial assets, a lot of people would ask questions of what are financial assets? What does Medicare CMS require as financial assets? So financial assets would include liquid cash in a checking or savings account and any stocks or bonds that the individual might have. Things like a home, car, and personal items are not counted as resources or assets that will count against the individual for the asset qualification. Now, there are also Medicare savings programs that are available. So if an individual is receiving full Medicaid, supplemental Social Security income SSI benefits, or assistance from their state Medicaid program that's paying for their Part B premiums for them, they will automatically qualify for extra help on their Part D. There's nothing that they need to do. An individual that's not currently getting the assistance that they feel that they're entitled to will have the opportunity to apply for financial assistance through one of the 4 Medicare savings programs. So let's talk real quick about the 4 programs. The first and the most popular one is the Qualified Medicare Beneficiary, which is known as QMB. So Qualified Medicare Beneficiary Program is if the monthly income is below $1,084, and as a married couple it's below $1,457 currently, and the financial assets are below $7,860 and $11,800 for a married couple, an individual could get help paying their Part A and or Part B premiums and will not be charged any of Medicare's deductibles, co-insurance, and copay. So if someone falls within that and within those financial barriers, then at that point going forward, you could qualify for QMB. There's also a second one called Specified Low Income Medicare Beneficiary, which is SLMB. Specified Low Income Medicare Beneficiary Programs is if the monthly income is below $1,296, and for a married couple it's $1,744, and the financial assets are below $7,860, and for a married couple currently $11,800, and the individual has Part A, they could get help paying their Part B premiums only with this particular program. They'd also get the extra help for the Part D. There's a Qualified Individual, which is known as QI. The Qualified Individual Program is if the monthly income is below $1,456, $1,960 for a married couple, and the financial assets are below $7,860 and $11,800 for a married couple, and the individual has Part A, they could get help paying their Part B premium only with this program. This program must be applied for every single year to get help for paying for the Part B premium only. It's on a first come, first served basis. So priority will be given to someone that qualified for this program the previous year. But again, this is something that has to be applied for every single year. The last one is very rare. It's not used that much. It's called the Qualified Disabled and Working Individuals Medicare Savings Program, known as QDWI. If the monthly income is below $4,339, and for a married couple it's below $5,833, and the financial assets are below $4,000, and for a married couple it's below $6,000, this program will pay for the Part A premium only. So remember, Part A is usually free. This one would pay for the Part B premium only. This program is for someone that is disabled and working under the age of 65, lost their premium-free Part A because they went back to work and are not getting the medical assistance from their state. So again, now you have a better understanding of the different ways that you could qualify for assistance for prescription drug coverage. If you have any questions at all, because we know this stuff is confusing, it's really overwhelming, you can watch this video again, but I would recommend that you pick up the phone, give us a call here at Healthcare Solutions Direct so that we can help assist you, make sure that you're doing the right decision for you. Thank you.